Okay, hey Ricky, we're just getting started on the right shoulder. We're looking in from the back to the front. You're laying on your side, so your arm is up in the air in a shoulder holder, and the rotator cuff's going to be to the left. First thing right out of the gate, we can see you've got a lot of arthritis in your shoulder. So you may very well benefit from one of our regenerative medicine injections like a PRP injection for longer term control of this shoulder, at least control of the shoulder symptoms, I should say. Here's your biceps tendon, this cord, and we're going to be doing a biceps tenodesis, so we'll need an anchor that we call a Poplok anchor. We'll need a shuttle relay right now just to secure the biceps because we're going to cut it here and reattach it outside the joint so it doesn't cause any more pain. Your rotator cuff is actually up here, and this is where it's torn. So we'll do some work there as well. We're going to look down around the back side of the joint down here. And same thing, look at tremendous amount of arthritis. The ball's not really round anymore. And you've got a lot of fraying of the labrum. Lift straight up on the arm for me, straight up. And so as we get in here, we can see you've got some full thickness cartilage loss where it turns kind of orange or yellow. That's bone that you normally can't see because normally there's a smooth layer of cartilage covering it up. And similar story on the humeral head up above. So okay, so we'll stop here for a minute. We're going to change positions. You can let go. Two switching. Okay, so now we're looking from the front to the back. We're using our shaver back here just to smooth out the rest of this labrum. And that's about as good as we can get that to look, I think. And this is the rotator cuff that's torn back here, so we'll deal with that last. Okay, so now we're going to switch back and we're going to get to work on the biceps tenodesis part. I just wanted to make sure we got this posterior inferior labrum sorted out. Okay, so we've placed a spinal needle. Give me a good picture. We've placed a spinal needle through the biceps and we've got a black wire coming through it. Once we feed enough of it in, we can capture it. We'll back the needle out, and now we're going to load that with a suture. So that's the first step. Next step is to do the same thing one more time. There we are, coming through a slightly different location. We're going to feed that relay through a bunch, and then we're going to cut the biceps. So we'll show you that in a little bit. Pause. Okay, so as we look here, come this way and see if you can look on that side. Yeah, is that better? Or that one, I don't care, but So here we've got the biceps secured. You can see how we've got that suture going around and through. And now we're going to release the biceps down here. We'll show you some more in a little bit. Pause. Okay, and so now the biceps is released. You can see how it just pops out. And we'll use our shaver one last time just to smooth out the labrum. Okay, and now as we look up, we can see the rotator cuff tear. So we're going to stop inside the joint and get to work up above the torn rotator cuff. Pause. I got it. Okay, so this is the rotator cuff tear. You had about a 90% tear, so the first thing we had to do was unroof it, which we've done. And now we're just getting a good look at it. Let me show you here. This is the tear right here. Those sutures over there for your biceps, which is running right down there. We're going to tack those down. But we're going to place a suture anchor in here. It might just be one anchor. Usually is when we just have to unroof it. We'll put one anchor down here. So we're going to take a spinal needle, check our angle of insertion here. That looks pretty good. See if we get right in the middle, we can place an anchor down. Looks like we can get an anchor down right about here and cover just about everything we need to cover. Okay, so here's our triple loaded anchor. There's 3 different suture pairs. They're color coded. So there's this blue and white group. Then there's a solid blue group. And then there's the black and white group. See how they split up? And so we're going to start with the blue and white group because it looks like that's the one farthest posterior. So I'm going to reach in here, grab that suture, bring it out the anterior cannula here. And now we're going to take a grasper in the front. And then we're going to take what we call a suture hook and bring that in from back here. And try and focus a little bit better for us. There we go. So this, yeah. So the suture hook comes in from the back. There it is there. It's loaded with a black wire. It's the same wire super shuttle that we used for the biceps. So we're going to hold the camera just like this. And then I use this other instrument, which is basically just a grasper, just to lift up. We're going to rotate a little bit. Yeah, so that gives me a pretty good idea of what I'm trying to do. If I hold that reduced like that, I like the way that looks. And now I can make a stitch. Like that. And so we'll go ahead and feed the wire. Retrieve it. And then we're going to load that outside your shoulder and pull that suture back. Go ahead. Okay, so here you can see as we pull, out brings that suture underneath. It comes out up above here. We can reach in here with our crochet hook and get the partner suture. This is why they're color coded. So now that's our first suture pair. We're going to do the same thing with the next suture with a turn to the right hook. And so here we'll take the solid blue one out the front. Grasper to okay, and so now we have a, go ahead and hold right there. We have a slightly different angled hook, as you see, right here. And there we are, just coming underneath. You can just see it right there. Pause. Okay, so now we've got 2 sutures passed and tied. We've got one more to work with, that black and white one. That one we're going to pass from the front. So here's what we do to make sure we don't have a big mess of suture. Hold the camera here. We're going to take out the cannula, and then we're going to put it back in with an inserter. And now those sutures are outside the cannula. So see, now they won't get in the way. So we can put the cannula here, and we can work with that last black and white suture without getting a tangle. So we're going to go ahead and reach in here. We'll take this suture, and notice how that's the only suture inside the cannula now. Everything else is outside. Grasp her into Bonnie. Okay, so now we've got this third suture. This is the third suture from only one anchor. These are triple loaded anchors. And so that's going to hold down this front part. And so now we're going to go ahead and work on tying these. We've got 3 to tie. And in order to do that, we're going to take these ones that are currently outside the posterior portal and bring them into, hold the cannula in the front, bring them into this anterior cannula. Okay. And then there's the first one that we did, the blue and white striped one. Okay, and so now in order to tie these, we're going to bring them into the posterior cannula right here, one at a time. So we'll pull this back. So now we're going to go ahead and we tie them in the same order that we passed them. I like tying from posterior to anterior. So there we go right there. So we're going to tie that first one, and then we're going to tie the blue, and then we're going to tie the black and white. Okay, so there's a pretty good picture of how that lays out. We'll show you some more in a minute. Hold the camera. Okay, so I want to give you the overall finished look. This is the cuff repair. Remember we had the blue and white suture first, then the solid blue, then the black and white. That looks great. Cuff's anchored. The biceps tendon has been anchored down with a suture anchor, and we just cut the sutures right there. That looks great. It runs back that way. And now we're going to do our final little magic trick here for you, Ricky. We're going to make some little holes in the bone to release the bone marrow elements. Go ahead. Keep going. Keep going. Okay, great. My old boss named this the crimson duvet, and you'll see why in a minute. But this has actually been shown to really accelerate the healing. Go ahead. Okay. And with this size tear, probably 2's enough. Maybe we'll make one more if we can do it. No, I think that's going to be good. Just 1, 2. Give me one more down here. Okay. And so now if you look, when we turn off the pump and turn the pressure down, you'll see some of the bone marrow elements like that little droplet right there start to come out. And that's what helps in the healing response. So we're going to be finishing up here. We'll get you back to the recovery room in just a few minutes. So good luck to you now. See how that works right there. That's the crimson duvet. Bye-bye.